Many of you have used GoodRx, but maybe we need to be calling it Bad RX. It turns out that a lot of you wonder, how does Facebook know I have rheumatoid arthritis? How does Facebook know that I have eczema? Like how do they know what's going on with you? That is because your friend, GoodRx, and there's some smaller competitors in the discount drug card market, Blink and Single Care. There's another one. They make their money by selling your information. They're not covered under HIPAA like you would think they would be. So people are like, how do they make their money? Well, they will tell you they make their money by transaction fee. Every time you use their card, they get a little bit of money. They have like gold and silver memberships, so they make a little bit of money from their subscriptions. But the big money maker is selling your information. And here's an article from Vox that said, the FTC finally got involved and said, no. It gave them a fine, $1.5 million fine. That's a very, very small little slap on the hand. But at least it's calling out the fact that they're selling your information. I don't want anybody to know what drugs I'm getting filled. They sell it to a very large insurance call center, one of the largest in the country, probably calls everybody. They know what drugs you're taking because they have a partnership with GoodRx. So hopefully some of this is going to get a little bit tighter scrutiny. I'm never one to call for more government, but if the companies aren't going to behave correctly, I think we need the government to step in on this. A lot of you are always asking me, how come I get so many calls? Well, like that. If you use those discount cards, if you read the fine print, what you've authorized them not to only call you indefinitely, but to sell that information to other insurance agents. Sell, give, barter, whatever, away. And like I said, you'd think HIPAA would protect your private health insurance information, but these discount cards are operating their own little orbit. I'm not saying not to use GoodRx. You can't. I don't think there's anybody that could get by without using GoodRx anymore because the prices of these drugs have skyrocketed. So yes, you will have a Medicare Part D, a drug program, and you might never use it. We might sell it to you with the intention that it's just there for a rainy day if you get really sick and bad things happen. But you're going to use GoodRx or Single Care or Blink or some other discount card because you only take one or two cheap drugs, and it's cheaper using these discount cards than it is using your actual insurance. And then people always say, well, why do I even have insurance if it doesn't work with insurance? We're just trying to cobble together a piece-made quilt here to try to get you your prescriptions at the best price. And oftentimes that means that you're not actually using your drug insurance. You're using these discount cards. I'm sure that was about as clear as mud. The one thing you should have taken away from this is nothing's free. These free discount cards that you can see everywhere aren't free because they're selling you. They're selling your information. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment. If you have a specific question, always feel free to call us or email us at the Medicare Family.